According to the Gale Encyclopedia of Medicine, about 75% of people will have hemorrhoids at some point in their lives. Hemorrhoids are most common among adults aged 45 to 65. Although about 50% of patients suffering from hemorrhoids would require treatment, but experts have revealed that only 4% of such patients will actually treat or find a solution to how they can actually treat hemorrhoids. For most people in Nigeria, hemorrhoids are called jedi-jedi or pie. I welcome you to another edition of African Contemporary and Alternative Medicine, African. And today, what we shall be discussing is hemorrhoids. And I have with me, for better discussion on what it means and how we can treat ourselves in the African complementary and alternative way. I have with me Mrs. Christina Olakpadi Ojo. I welcome you to the program.
Thank you very much. Thank you for having me.
To go straight into the topic that we have for today, hemorrhoids. Generally, it is known to be called jedi-jedi or pie. What can we say is jedi-jedi? There are different definitions, different misconceptions, but to just get it, what can we say typically is jedi-jedi or hemorrhoids?
The term jedi-jedi itself in the Yoruba language simply refers to the sensation felt by the sufferer of the complication of pile itself, because when anyone has that pile and then it has led to the jedi-jedi feeling, it means that the person is having itchy sensation around the anal ring where poop comes out from. But jedi-jedi is far beyond just, that itchy sensation. It's a range of occurrences that has to do with the gastrointestinal tract, such that it has to do with the food you eat, it has to do with the time that you eat your food, it has to do with, how you live your lifestyle. So jedi-jedi in itself is a lifestyle, dietary and hereditary condition. Everything is intertwined. Now, before jedi-jedi begins, it starts with constipation. And what is constipation? Constipation is when feces is hard and difficult to pass out. So you see some people in the restroom trying to defecate, and it's taking them a lot of effort. Some would cry. In fact, some people require lubricants like Vaseline to help pass out these feces. Now, when feces is hard, and of course constipation is caused by foods that are not rich in diet, when water is not enough, and we have a lot of that in this part of the world. We eat a lot of tuber food, yam. If it's not yam, we're eating something from cassava. So when constipation starts, the movement of this hardened stool within the colon usually sometimes causes bruises inside or near the close to the anus, which is known as the rectum. So when this hardened stool bruises those internal veins within the colon, we might experience bleeding. That's why some people eventually, when they're able to pass the stool, they will see some traces of blood in their stool. Now, that aside, because of the stress, the tension that, the colon is going through, trying to pass out constipated, hardened feces all of the time, it is very likely that the rectum would have become inflamed due to stress. The nature of the rectum is it's quite mucosal, quite muscular. It's not no skeleton, it's not tough. So most of the time when it's going through that much stress, there is every likelihood that that region will be inflamed. And the region happens to fall between the lumbar vertebra and the sacral. That's the very lower back of the vertebral column. So once that part is inflamed, it affects the back, and thus the person may develop back pain. So most of the time you find out that people that complain of jedi-jedi, they'll be experiencing hard stool, they'll have difficulty in bowel movement, they will experience back pain. And then the most, or maybe I should say, the second to the most difficult one is when the rectum comes out along with the feces. Because when the feces is so dry, there is a very high likelihood that the rectum would have stuck to the feces while the feces is resting there. So when the person tries to push out the rectum, that's when the rectum comes out with the feces, and they will say the person has rectal or anal prolapse. Prolapse is when, you know, the internal organs come outside. So when that happens, it becomes a real issue. And we have also observed in a few people that this prolapse seems to be hereditary, because it is not everyone that has this jedi that actually experience prolapse. Some people, their jedi may not even be so severe yet, and they are already experiencing prolapse. And it happens a lot in children too. Now, aside that, you also have people who bleed. And, you know, the other time I mentioned that when there is abrasion of internal veins, they might experience traces of blood in their stool. But there are cases when people, after passing stool, they outrightly bleed into the latrine.